Hello and welcome to this lecture on the brachial plexus. I want you to get out a white piece of paper and use some coloring tools, whether that's markers or colored pencils, crayons, whatever you've got. I really like using highlighters for this. So let's get into it. First, let's discuss what the brachial plexus is. That word plexus is referring to a network of nerves or a braiding of nerves, which we see over here. Now, this network of nerves are there to supply the structures of the upper limb. So areas like obviously the arm and forearm and all the way down to the hand, but also some of our shoulder muscles and our chest muscles. The term plexus in Latin means a twining or braiding. And so we are going to go through this entire network starting at the ventral rami, then moving into our trunks and our divisions, our cords, and our terminal nerves. So let's start off by looking at just some of those major structures here. So first we have the roots, which are really the ventral rami, and you don't see the numbers here, but it is C5, C6, C7, C8, and T1. From there, we're going to create three trunks, superior, middle, and inferior. And then we've got some anterior and posterior divisions. So we will see that all the posterior divisions are going to start to course together, whereas the anterior divisions, they kind of branch off into other areas. And then we've got our three cords, which would be our posterior cord and our lateral and medial cords. And from there, we have our terminal branches. Now, the formation of our brachial plexus starts at, like we said, the roots or the ventral rami. So our spinal plexi will never come off of the dorsal rami. That's because we know the dorsal rami will go and supply structures of the deep back, whereas we know the brachial plexus supplies the shoulder, chest, and all of the upper limb, really. We talked about our ventral rami being C5 down to T1. And we will see that some of these ventral rami are going to come together to form our three trunks. So you'll see this superior trunk is also referred to as an upper trunk, and we could see that C5 and C6 are coming together to create that. Then we've got C7 by itself continuing to create the middle trunk, and then C8 and T1 will come together to create the inferior or the lower trunk. And this is going to be in the neck region. And I wanted to show you how this looks like in a cadaver. So you can see our ventral rami coming out over here. And then C5 and C6 create the superior trunk. C7 creates the middle trunk. And C8 and T1 come together to create the inferior trunk. So here we are with our blank sheet, and we are going to draw this in. So I'm going to start off on the right side of the page. If you want, you could start off on the left side, but it might get a little confusing. Most of my cadaveric images from BlueLink via University of Michigan, I believe is drawn, well, let's look in this previous one. It's set up in the same manner that we are going to draw it. So here we're going to put in our ventral rami, C5, C6, C7, C8, and T1. And of course, we talked about how those ventral rami come together to create our three trunks: superior trunk, middle trunk, and inferior trunk. So you might want to pause this video in order to draw just this portion. This schematic will also go into detail as far as the other branches that come off of the brachial plexus. So one is going to be this dorsal scapular nerve that comes off the ventral rami of C5. And from C5, C6, and C7, we have the long thoracic nerve that supplies our serratus anterior muscle. And just to show you a little bit more detail about these two nerves, you can see the dorsal scapular nerve over here. Like we said, it comes off of C5 and will course deep to levator scapulae and enters the deep surface of the rhomboids, and it goes to supply the rhomboid major muscle and the minor muscle. Then we have our long thoracic nerve, which you can see coming off down over here. Again, it comes off ventral rami C5, C6, and C7, and will course posterior to the axillary artery that would descend through the armpit region and on the external surface of the serratus anterior muscle, which it supplies. Now we are going to move past the trunks and discuss the anterior and posterior divisions. So you can see the anterior divisions in red here, whereas the posterior divisions are in the pink. The anterior divisions of the upper and the middle trunks are going to join to create the lateral cord, which is in yellow here. The other anterior division, lost my mouse there. The other anterior division from the lower trunk is going to continue to create the medial cord, which is this cord right in here. And lastly, we said those three posterior divisions are going to come together to create the posterior cord. So let me show you how this looks in the cadaver, and then we will add this into our drawing. So now we have switched views. We are looking at the left side here. You could see the upper, middle, and lower trunks. So from this upper trunk, we see one anterior division. And from the middle trunk, here's our other anterior division coming together to create that lateral cord. Then we have our last anterior division given off from the lower trunk to create the medial cord. And lastly, in green, we see all of the posterior divisions coming from the upper, middle, and lower trunks come together to create the posterior cord. So let's add this to our drawing. First, you're going to draw the posterior divisions. So coming from the superior trunk, middle trunk, and inferior trunk, and you want to kind of draw it so that they are all intersecting here. And then we're going to add in our anterior divisions. So draw one line from your superior trunk and one line from your middle trunk coming together and intersecting here. And just one line serving as the anterior division from your inferior trunk going straight across. So naturally we have some more nerves coming off. So we've got our nerve to subclavius. And then coming off of the superior trunk, we also have the suprascapular nerve. So let's take a look at that nerve to subclavius first. Here's our brachial plexus, and you can see it's a teeny tiny nerve coming off over here, originating from the upper trunk, and it'll descend just posterior to the clavicle to supply the subclavius muscle. Now our suprascapular nerve takes an interesting path here. It also comes off of the upper trunk, and it's going to course laterally and posteriorly, and it passes through this special little area here known as the suprascapular notch. So you may have seen this as you're looking at the scapula, and there's a little ligament that kind of holds it in place. And from that area, we can then enter the supraspinous fossa to innervate the supraspinatus muscle. That nerve will then continue around the spine of the scapula, as you see here, and enter the infraspinous fossa to innervate the infraspinatus muscle. All right, now we have made it from those anterior and posterior divisions to our three cords. So all of these cords will be found in the axilla in the armpit. They are named lateral, posterior, and medial, indicating their location around the axillary artery. So if I were to kind of draw in or shade in where that axillary artery would be, I'm debating what color to put this in, but it would be right through here. Okay, and of course it continues down. I want to try and keep this as, I don't know, as three-dimensional as I can, I guess, but the thickness of this is not working for me. Anyway, so the artery is sitting on top of the posterior cord, right? Meaning the axillary artery is anterior, leaving the posterior cord posteriorly. The lateral cord would then be lateral to the axillary artery, and the medial cord would be medial to it. That makes sense, right? Okay, so let's get rid of that. And in this area, we will see that a total of 8 nerves will be given off, and then we'll continue this down distally so that we can give off 4 other major nerves. So let's take a look at this in the cadaver. We can see that we have the medial cord. You don't see the axillary artery in here, by the way, but it would be sitting right along here. So this would be our medial cord, our posterior cord, and our lateral cord. So now let's draw that into our drawing. So we've got the lateral cord coming off where these 2 anterior divisions intersected. And coming off of the lateral cord, we have the lateral pectoral nerve. And then where the 3 posterior divisions intersected, you want to draw in your posterior cord. And off of our last anterior division here, we are going to draw in our medial cord. Now, off of our medial cord, we have the medial pectoral nerve, the medial brachial cutaneous nerve, and our medial antebrachial cutaneous nerve. Off our posterior cord, we have the upper subscapular nerve, thoracodorsal nerve, and the lower subscapular nerve. So, our last one will be the axillary nerve, and now we've got a total of, let's see, 6, 7, 8. Or 8 branches we talked about. So let's go through each one of those nerves just so you have an idea what they're supplying and where they're traveling to. First one is that lateral pectoral nerve that arose from the lateral cord, and this is going to course through the fascia above the pectoralis minor, which we see right in here. And it is traveling into the deep surface of our pectoralis major muscle over here, which it is supplying. Next, we will do the branches that come off of the medial cord, and that would include the medial pectoral nerve, which we saw in the previous slide, right? You can see it is supplying the pectoralis minor muscle and pectoralis major, and we see it in this illustration as well, right over here, where it is coursing and supplying pec minor and pec major. Now for our medial brachial cutaneous nerve, we don't really see it illustrated here, but we know that it's going to pierce through fascia of the proximal arm, and it's going to supply the skin on the proximal arm here as it travels through. And lastly, we have our medial antebrachial cutaneous nerve. Ante means before, so this is like your forearm translated. And this is going to travel through. We do see it pictured here, and it is headed down to the middle of the forearm, and it pierces the antebrachial fascia there to give supply to the skin on the medial forearm that you could see pictured here in the green. Now for our last group of nerves, these are the nerves that come off of the posterior cord. So we'll begin with the upper subscapular nerve. This is going to course to supply the subscapularis muscle, which you see pictured here. This is an anterior view of the scapula. Next we have the thoracodorsal nerve. That is going to come off of the posterior cord here and descend on down. And its job is to go to the deep surface of the latissimus dorsi muscle to give supply there. Then we've got our lower subscapular nerve. You could see that lower subscapular nerve coming off of the posterior cord here. And that is traveling along the anterior surface of the subscapularis muscle and will divide into 2 muscular branches. One supplies the subscapularis muscle, which we see that muscle here again, and the other branch is going to supply the teres major muscle. So you can kind of see that split taking place right along in here, but it's a little difficult to tell in the coloring. And lastly, we've got our axillary nerve, and we don't see that nerve pictured in the image above here, but we can see it in this view. So this is a posterior view of the scapula, and we see that axillary nerve just peeking out over here, and this area is called the quadrangular space of the shoulder, and it passes medial to the surgical neck, of the humerus, and it's going to innervate the deltoid muscle, which you see pictured here, and the teres minor muscle. So you kind of see a branch reaching out and supplying the teres minor muscle over here. Now let's take a look at that posterior cord. It is in the pink over here. Oh, sorry, the posterior cord is over here, and what we're seeing is it giving a rise to the radial nerve. So let's go ahead and draw in that radial nerve, and that's going to be this line over here in the purple. So remember, the radial nerve is a continuation of the posterior cord of the brachial plexus, beginning after this axillary nerve is given off. So here is another view, this time without the coloring. Here's our posterior cord, and here is our radial nerve. Notice how we're labeling it radial nerve after that axillary nerve is given off. And here's a great view of the axillary nerve with the muscles still intact. We see the quadrangular space and that axillary nerve coming on out, giving supply to the deltoid muscle. And we also see a little branch going and supplying the teres minor muscle. Now let's take a look at the median nerve. So notice we have quite a path here to get to the median nerve. We'll see contributions from both the lateral cord and the medial cord. So let's go ahead and draw this in. This is going to be a little bit more challenging to draw in. What you're going to do is draw one line from the lateral cord, and we'll label that the lateral root of the median nerve. And you want to kind of draw this in staggered alongside the radial nerve. So the other line you're going to draw in is a branch from the medial cord, and you will label this as the medial root of the median nerve. And where those two roots come together, that's where we will see the median nerve. Our median nerve is derived from the lateral root of the median nerve and the medial root of the median nerve. So let's go ahead and take a look at our musculocutaneous nerve next. If we go back to that lateral cord, yes, we see the lateral root of the median nerve here and the median nerve, but also notice from the lateral cord we have another terminal branch, and that's going to be the musculocutaneous nerve. So back to our drawing, we're going to go to our lateral cord, and you want to draw a line extending out of there, and that will be our musculocutaneous nerve. Our musculocutaneous nerve is a continuation of that lateral cord and begins after the lateral root of the median nerve is given off. So once again, let's take a look at that. It's not highlighted here, but here is going to be your lateral cord. And then you could see musculocutaneous nerve is moving in this direction laterally, whereas the lateral root of the median nerve moves a little bit more medially to create that median nerve. Now let's talk about the ulnar nerve. And you could see that pictured here, colored in the pink. This is your ulnar nerve, and it is coming from this medial cord. So let's go to our medial cord in our drawing and add that line to create our ulnar nerve. Our ulnar nerve, as you can see, is a continuation of this medial cord after the medial root of the median nerve is given off. So if we go back here, you can see your medial cord, and this is our medial root of the median nerve. And at that point, when it's given off, this is now our ulnar nerve. And here's a nice little review of the musculocutaneous nerve being given off on the lateral side. So that is it for your brachial plexus. Please let me know if you have any questions at all.